Hello and welcome to this next episode wherein we will be discussing the frontalis muscle injections. So far, we have seen the injections for the crow's feet and the glabellar complex. So let's move on to the frontalis muscle injections. So when we are dealing with the horizontal forehead lines, it is the frontalis muscle that we are dealing with. So these are the horizontal forehead lines. The formation of these lines can vary from person to person and on their age and also the amount of activity the frontalis muscle is having and so many factors. Sometimes they run through and through the forehead. Sometimes they're broken lines. Sometimes they're continuous. So the patterns will vary in different people according to the use and skin quality. Now, Botox is indicated in the treatment of forehead lines. Now, careful consideration has to be made before treating to minimize possible brow ptosis. So, brow ptosis is a condition which arises when the frontalis muscle is not injected in the appropriate place. So, identifying the right place to inject is important. Otherwise, the brow ptosis, which happens, it's very demotivating for the clinician and the patient as well. So despite the technique used, a portion of or area of muscle must be left untreated to maintain elevation of the eyebrows. Now we know that frontalis is the only brow elevator of the forehead, and we cannot just remove its action. And also, frontalis has two actions. One is the brow elevation, and the other one is pulling the hairline in forward. And these two muscle actions, there is a center line or there is a midline, which is known as the line of convergence. And that is a line wherein the lower half and the upper half of the frontalis have the different functions where they are conjoined at that line. So that is called the C line. And we will be discussing about an entire forehead and frontalis in the next episode. But so far, we have to understand that when you are injecting the forehead, the safe zone is 1 to 1.5 centimeter above the eyebrows. You do not have to inject in that zone. That is beneath the red dotted line. You do not have to inject, no matter how many wrinkles are there. We cannot correct the low-lying wrinkles in the forehead. If we ever try to do that, we will end up in trouble causing brow ptosis. So only the upper half of the frontalis has to be dealt with. For the horizontal forehead lines, this has to be very clear. So despite the technique used, a portion or area of the muscle must be left untreated, which is the lower half or lower 1/3. If the forehead is broad, then take it as lower 1/3. If the forehead is narrow, then take it lower half. In general, leave the muscle below the first uninterrupted righted, untreated, leaving for a portion of working muscle. So that means we need to leave a little amount of working muscle, which can perform the action of brow elevation. We cannot compromise on that action because brow elevation is required in a lot of expressions. So this rule can be applied to all frontalis treatment techniques to ensure better brow elevation. Now, horizontal forehead lines, the injection techniques. You have to inject 6 to 15 units in women and slightly more than like maybe up to 20 units in men. Overall, there can be 4 to 8 injection sites depending upon the expanse of the forehead or the width and breadth of the forehead. However, more or few may be required based on the anatomic and aesthetic evaluations. So review the patients in 2 weeks, treat higher into the hairline in males with receding hairline, which will give them more aesthetic results. A smaller dose may be appropriate for patients wishing to maintain some movement. Keeping the injection sites evenly spaced across the full width of frontalis, and consider interactions with procerus, corrugator, and oculi in overall facial shape. Now, the last point I want to emphasize that all the points that have been shared with you or that will be shared with you during our PPTs have been kept in mind, and there are more inclined towards giving more aesthetic results. So you have to just follow them step by step because these all considerations have already been made while deciding the injection points. So frontalis muscle, the action is its contraction leads to the horizontal forehead line. So this is not the action actually. Action is the brow elevation, and because it's inserting into the skin, as it contracts, the skin overlying the muscle falls into creases, and that these are what we commonly call as horizontal forehead lines. So the depth with a 30 to 33 gauge half-inch needle, which is the tuberculin syringe, is you have to just inject with the upper 1/3 of the needle going inside the skin, running parallel to the forehead. Pinch the skin before you inject. So it is per point you inject 1 unit to 4 units or 1 units to 4 units of reconstituted Botox. And in women, I feel 1 unit is sufficient, and in men, 2 units per injection site will give good results. There is another technique which is called the M-shaped technique, which I'll be discussing, which is very good for beginners. But in that, every point is injected 4 units. So in all, so this PPT, the points shown in this PPT are basically the original points which we were doing now. Recently, the M-shaped technique, or with the advent of 64 units Botox for forehead, new injection points have been derived, which again will be discussed soon. So total dose range area is in the forehead, you can give 20 units, up to 20 units. So in women, it would be anywhere around 15 to 20 units, and in men, anywhere around maximum 20 units. So this is the total dosage in the upper forehead. Lower forehead, we do not do for horizontal forehead lines. We are only doing glabular complex. Lower forehead, lower 1/3 or lower half of the forehead needs to be left. So when we are doing Botox for forehead lines, you first do the marking. First mark the no-go zone, then mark the points, injection points. You ask the patient to contract the muscle and see where all the expression lines are there. And then after the marking, you do the marking, evenly spaced out marks, and then start injecting. After the marking, you need to sanitize it, or you need to, put your alcohol cleanser. And once you have done your alcohol cleanser, no other marking should be done. Just before injecting, you need to clean the area properly to avoid any kind of infection. So frontalis, upper 1/3 of the needle, gently pinch the skin and see a papule. You have to raise a papule while injecting the forehead. So some technical recommendations: that cheek eyebrow height, frontalis strength, and skin elasticity matter a lot when you are injecting the frontalis. So for example, if somebody has a good tone, a woman with good skin tone, I can give 2 units per injection site also. But for a woman with loose skin in her 60s or in her late 50s or 60s, where skin laxity is too much, I wouldn't give 2 units per site. I would give just 1 unit per injection site to be safe. So check for any asymmetry. So this is very important when you are injecting the forehead. Check for the asymmetries of the eyebrows, because 5% of asymmetry is common in all the faces. We do not know it because we are so used to seeing our faces otherwise. And these asymmetries can sometimes be aggravated or come to notice only after the injections have been done. So if there are any mild to minute asymmetries, make note of them before itself. Over-injection of frontalis may lead to medial or lateral brow ptosis. And there are techniques where you need to avoid the Spock looking, like Spock or Mephisto sign. So this is how you inject. See the angle the needle is making with the skin. It's just almost parallel. So when we start marking the forehead lines, first we have to do is first mark the midline of the forehead. Then you mark the lateral aspects, like draw line in both the temporal crests. So you do not have to go beyond the temporal crest for injecting the frontalis. Just stay within the lines of the temporal crest. Sometimes you need to, instead of temporal crest, you can even take the mid-pupillary lines also. But in men, I usually take the temporal crest as the lateral border. And in women, I usually take the mid-pupillary line as the lateral border. So once you have taken out this area, mark the area, then evenly distribute your injection points 1 centimeter apart. Now, why do you have to distribute 1 centimeter apart? Because the diffusion of the Botox is almost around 1 centimeter. So evenly distribute your injection points within the marked area and then start injecting. So that is how you go about injecting the forehead. So that's about the forehead for now. In the next video, we are discussing about forehead and the M technique, that is a 64-point technique for forehead. And we'll be discussing the biomechanics of the frontalis muscle. So if there are any doubts, you can always share them in the messages below, and see you in the next video.